During a venipuncture, you notice the patient's arm trembling uncontrollably. What is your safest course of action? A. Proceed immediately, holding the needle firmly. B. Pause, remove the tourniquet, and allow the patient to relax before attempting again. C. Use a larger needle to compensate. D. Ask the patient to clench their fist harder. Answer: B. Shaking can cause injury or hematoma. Pausing and calming the patient ensures safety and proper collection. A patient has severe scarring on both arms from burns. Which action is most appropriate? A. Use the scarring site since veins are visible. B. Insert the needle blindly between scars. C. Skip disinfection because skin may be sensitive. D. Consider alternative sites such as hand veins or dorsal foot veins after approval. Answer: D. Alternative sites minimize trauma, and clinician approval ensures safety. While performing a blood draw, you notice the patient has a medical alert bracelet indicating hemophilia. What is your next step? A. Proceed normally, no special precautions. B. Draw only from the hand veins. C. Avoid drawing blood entirely. D. Apply a smaller needle and longer post-draw pressure, and notify the nurse. Answer: D. Hemophilia increases bleeding risk, extra pressure and careful technique are critical. A patient has a PICC line in the right arm. You need a blood sample. What should you do? A. Draw from the PICC line directly. B. Use the left arm or consult nursing staff for an alternative site. C. Draw from the right arm anyway. D. Attempt capillary collection on the same arm. Answer: B. Avoid drawing from PICC lines unless specifically trained and approved. Use alternate sites to prevent infection or line compromise. A tube contains a polymer gel barrier, but you accidentally shake it vigorously after collection. What is the likely consequence? A. Hemolysis and inaccurate test results. B. Faster clotting. C. Increased serum volume. D. Nothing happens. Answer: A. Vigorous shaking can rupture red blood cells, altering lab results. Gentle inversion is required. During a capillary puncture on an infant, you notice the blood flow is extremely slow. What is the recommended technique? A. Apply firm pressure on the puncture site. B. Increase puncture depth. C. Warm the heel before puncture to improve circulation. D. Use a standard adult lancet. Answer: C. Warming improves peripheral blood flow, reducing trauma and improving sample yield. While drawing blood, the patient develops a sudden rash and hives. What should you do? A. Continue collection quickly. B. Apply pressure and ignore rash. C. Stop immediately, remove the needle, and alert medical staff. D. Document and finish the draw. Answer: C. Rash and hives may indicate an allergic reaction. Stopping the procedure and seeking immediate help prevents escalation. A patient requests that you only use the veins in their non-dominant arm. Which is your proper response? A. Refuse and use any accessible vein. B. Attempt using the non-dominant arm but switch if inaccessible, explaining the reason. C. Ignore patient preference. D. Cancel the draw. Answer: B. Patient comfort is important, but safety and accessibility guide the final site selection. You notice a specimen tube has a cracked cap after collection. What should you do? A. Tape the cap and continue. B. Send as is to the lab. C. Pour blood into another tube. D. Discard the tube and recollect. Answer: D. Cracked tubes risk contamination, leakage, and inaccurate results. Recollection ensures integrity. A patient has a history of fainting during blood draws. How should you prepare? A. Reassure and proceed without additional measures. B. Have the patient lie down or recline, and monitor closely during collection. C. Draw only capillary samples. D. Avoid venipuncture entirely. Answer B. Reclining reduces syncope risk and improves patient safety during phlebotomy. While performing a draw, you notice a small hematoma forming. What is your immediate action? A. Withdraw needle, apply pressure, and elevate the limb. B. Continue drawing to finish quickly. C. Massage the site vigorously. D. Ignore and document later. Answer A. Applying pressure immediately prevents further bleeding and reduces tissue damage. A patient has 4 fluids running in the left arm. You must collect a sample. What is safest? A. Draw from the same arm above the 4. B. Draw from the opposite arm or below 4 with nursing approval. C. Stop 4 and draw immediately. D. Draw through 4 line directly. Answer B. Drawing from in 4 site can dilute blood or introduce infection. Alternative sites are preferred. Which of the following is an indicator that a tourniquet is applied too tightly? A. Palpable vein. B. Normal capillary refill. C. Pulsation visible. D. Patient discomfort, numbness, or swelling. Answer D. Excessive pressure can cause pain, hemoconcentration, or nerve injury. A phlebotomist accidentally punctures an artery. Which signs confirm this? A. Dark red, slow-flowing blood. B. Bright red, pulsatile flow. C. Clotted blood. D. No blood return. Answer B. Arterial puncture is bright red and spurting. Stopping immediately and applying pressure is essential. Which of the following is the safest way to dispose of a used lancet? A. Throw in regular trash. B. Recap and store. C. Use a sharps container immediately. D. Leave on work surface. Answer C. Sharps containers prevent accidental injury and comply with infection control protocols. You observe a patient shaking during the draw, but the needle is in place. What should you do? A. Continue drawing and secure the needle with minimal adjustment. B. Withdraw immediately. C. Ignore and hold patient still. D. Use a larger gauge needle. Answer B. Withdraw immediately because shaking can cause needle injury or vein damage. A patient is on anticoagulant therapy. Which precaution is most important? A. Apply pressure longer than usual post-draw. B. Use a smaller tube. C. Avoid tourniquet entirely. D. Use heel stick only. Answer A. Anticoagulants increase bleeding risk. Extended pressure prevents hematoma formation. You notice a specimen label is smudged. What is the correct procedure? A. Send to lab anyway. B. Cover with tape. C. Use pen to rewrite over smudge. D. Relabel immediately with correct patient info. Answer D. Accurate labeling is critical for patient safety and avoiding misdiagnosis. Which is the safest method to mix a blood sample with anticoagulant? A. Shake vigorously for 10 seconds. B. Invert gently 5 to 10 times. C. Stir with needle. D. Leave upright. Answer B. Gentle inversion ensures proper mixing without hemolysis. You are collecting blood for a fasting glucose test, but the patient reports eating 30 minutes ago. What should you do? A. Proceed anyway. B. Draw and mark fasting regardless. C. Ask patient to wait 5 minutes. D. Document and notify nurse for possible rescheduling. Answer: D. Eating affects glucose results. Notification ensures accurate testing. A patient's vein collapses during draw. What is the next best step? A. Apply more tourniquet pressure. B. Switch to a smaller gauge needle and alternate site if necessary. C. Push the needle deeper. D. Draw from the same spot repeatedly. Answer: B. Collapsed veins require smaller needles or alternate sites to prevent injury and collect an adequate sample. While drawing a CBC, you accidentally fill a serum tube first. What is the consequence? A. No effect. B. Hemolysis. C. Faster clotting. D. Contamination may invalidate test results due to incorrect additive order. Answer: D. Following the correct order of draw prevents cross-contamination from additives. A patient refuses venipuncture. What is the phlebotomist's correct response? A. Force the draw. B. Respect refusal, document, and inform nurse or physician. C. Argue with patient. D. Proceed with capillary stick without consent. Answer: B. Patient autonomy must be respected, and refusals documented for safety and legal compliance. Which of the following indicates a potential sample contamination? A. Hemolyzed serum. B. Clotted anticoagulated tube. C. Lipemic or milky appearance. D. All of the above. Answer: D. Visual inspection identifies hemolysis, clotting, or lipemia, which can affect test accuracy. A phlebotomist needs to draw from a patient with 4 fluids in both arms. Which is appropriate? A. Draw below 4 if possible with nurse's guidance. B. Draw from arm closest to 4 line. C. Stop and reschedule only. D. Use capillary stick on forearm. Answer: A. Careful site selection and collaboration prevent contamination and dilution. A tube was accidentally left at room temperature for 3 hours before centrifugation. What is likely? A. No effect. B. Some analytes may degrade, requiring recollection. C. Faster separation. D. Increased hemolysis only. Answer: B. Certain tests require timely processing. Delay can compromise accuracy. You notice bruising on a patient from prior draws. What precaution should you take? A. Avoid that area and use a different site. B. Continue in same spot. C. Massage area before puncture. D. Apply tourniquet harder. Answer: A. Avoiding bruised areas prevents further tissue damage and patient discomfort. During a blood draw, the patient begins coughing violently. What should you do? A. Continue drawing. B. Remove the needle and assist patient to recover. C. Ignore and finish quickly. D. Ask patient to hold breath. Answer: B. Sudden coughing can cause movement. Stopping ensures safety and sample quality. A phlebotomist is drawing from a patient with fragile veins. Which needle gauge is preferable? A. 16G. B. 21 to 23G butterfly. C. 18G straight. D. 25G hypodermic. Answer: B. Smaller butterfly needles reduce vein trauma and improve success rates in fragile veins. Which action reduces pre-analytical errors in phlebotomy? A. Following order of draw, labeling correctly, and proper handling. B. Shaking tubes aggressively. C. Ignoring patient fasting status. D. Using expired tubes. Answer A. Correct procedure minimizes errors and ensures lab results are reliable. A patient has extremely fragile veins and a history of repeated failed draws. Which combination of techniques is safest? A. Apply firm tourniquet pressure and use a large bore needle. B. Use a butterfly needle, minimal tourniquet time, and warm the site. C. Use a 16G straight needle without warming. D. Skip antisepsis to save time. Answer B. Butterfly needles, minimal tourniquet time, and site warming reduce vein trauma and increase collection success. During a venipuncture, the tube begins to backflow, drawing blood into the patient's arm. What is the correct response? A. Withdraw the needle and apply pressure. B. Continue drawing and document. C. Increase vacuum pressure. D. Leave needle in and switch tubes. Answer A. Backflow poses risk of contamination and hematoma. Removing the needle and applying pressure prevents injury. A patient's arm is severely edematous due to heart failure. How should you proceed? A. Draw from edematous tissue regardless. B. Use a site distal to edema or alternative site with nurse consultation. C. Apply extra tourniquet pressure to compress edema. D. Use capillary puncture on the same arm. Answer B. Drawing from edematous tissue can dilute specimens. Alternate sites ensure accurate results and safety. While performing a glucose tolerance test, the patient complains of dizziness and nausea mid-procedure. What should you do? A. Ignore and continue timed draws. B. Stop, assess the patient, and notify the nurse or physician. C. Give patient water without documenting. D. Skip next blood draw. Answer B. Symptoms may indicate hypoglycemia. Patient safety takes priority over procedural timing. You are drawing a sample from a patient with 4 antibiotics in one arm. What is the best site selection strategy? A. Above the 4 line in the same arm. B. Draw directly from 4 line regardless. C. Use a foot vein without approval. D. Opposite arm or consult nurse for alternative site. Answer D. For medications can contaminate samples, using an alternative site or consulting ensures accuracy. A tube containing EDTA was underfilled. What impact could this have? A. No effect. B. Alters blood to additive ratio, potentially causing inaccurate CBC results. C. Accelerates clotting. D. Improves sample stability. Answer B. Proper tube fill is critical. Underfilling disrupts additive ratio and compromises test results. During a venipuncture, a patient suddenly becomes pale and begins to sweat. What is the immediate action? A. Withdraw the needle, lower the patient's head, and elevate legs. B. Continue the draw to finish quickly. C. Apply tourniquet tighter. D. Ignore and finish. Answer A. These are classic signs of syncope. Prompt intervention prevents injury. You accidentally puncture a patient's artery. After removing the needle and applying pressure, what additional step is required? A. Leave patient unattended. B. Monitor site for pulsatile bleeding or hematoma and document. C. Massage the area. D. Apply tourniquet again immediately. Answer B. Monitoring prevents complications such as hematoma or continued arterial bleeding. Proper documentation is required. A specimen must be kept at 4 degrees Celsius immediately after collection. However, the refrigerator is broken. What should you do? A. Leave at room temperature and send to lab. B. Notify supervisor, follow lab guidelines for temporary storage, and document. C. Freeze in an ice tray. D. Warm to room temperature. Answer: B. Temperature-sensitive specimens require strict handling, proper documentation, and following protocol prevent invalid results. A patient with a central venous catheter, CVC, requests blood draw from the catheter. What is correct? A. Draw from the CVC only if trained and protocol approved. B. Always draw from the CVC regardless of training. C. Draw from peripheral vein without notifying nursing staff. D. Avoid blood draw entirely. Answer: A. CVC draws require special training to prevent infection and line damage. Following protocol ensures safety. During pediatric capillary collection, you notice the child pulling the finger repeatedly. What is the best approach? A. Apply more pressure and proceed. B. Have the child seated securely, distract them, and proceed gently. C. Forcefully hold the finger. D. Cancel procedure. Answer: B. Distraction and secure positioning reduce movement, ensuring safety and sample quality. A blood culture bottle shows bubbles after collection. What does this indicate? A. Proper collection. B. Tube is overfilled. C. Sample is ready for centrifuge. D. Possible improper technique or contamination. Answer: D. Bubbles may indicate air contamination, compromising culture results. A patient is taking a medication known to affect potassium levels. Which precaution is critical when drawing a serum tube for potassium testing? A. Use tourniquet for extended time. B. Minimize tourniquet time and avoid fist clenching. C. Shake tube vigorously. D. Draw from 4 line. Answer: B. Prolonged tourniquet use or fist clenching can falsely elevate potassium levels. Careful technique ensures accuracy. A patient's veins are difficult to locate due to obesity. What technique can help? A. Use a warm compress and palpate carefully. B. Apply excessive tourniquet pressure. C. Blindly insert needle. D. Draw only capillary blood. Answer: A. Warming and palpation improve vein visibility and reduce trauma. You accidentally collect the wrong patient's sample. What is the correct protocol? A. Label as yours and send. B. Discard sample, recollect from correct patient, and document error. C. Swap labels. D. Inform patient later. Answer: B. Wrong patient samples can lead to misdiagnosis. Immediate correction and documentation is mandatory. Which of the following is a critical sign that a tourniquet should be removed immediately? A. Patient feels tingling or numbness. B. Vein is prominent. C. Needle inserted easily. D. Tube filling properly. Answer: A. Tingling or numbness indicates impaired circulation. Removing the tourniquet prevents complications. A tube is received in the lab with visible clot in an anticoagulated specimen. What likely caused this? A. Tube was inverted properly. B. Inadequate mixing or delayed draw. C. Blood flowed too fast. D. Sample was refrigerated. Answer: B. Anticoagulated tubes must be mixed gently. Improper handling leads to clotting and invalid results. A patient's hand vein collapses during a syringe draw. What is best? A. Switch to a butterfly needle or alternate site. B. Apply more suction. C. Massage the vein. D. Continue pulling plunger. Answer A. Collapsed veins require gentle technique and alternate devices to prevent injury and sample loss. A phlebotomist needs to collect blood from multiple tubes with different additives. Which principle is most critical? A. Order of draw to prevent cross-contamination. B. Use the largest tube first. C. Shake all tubes vigorously. D. Ignore additive type. Answer A. Correct order prevents additive carryover and ensures accurate test results. During a post-venipuncture check, you notice slight bleeding despite pressure. What is the correct action? A. Remove pressure and leave patient. B. Apply additional pressure and elevate arm if needed. C. Ignore and continue rounds. D. Apply tourniquet again. Answer B. Persistent bleeding requires continued pressure to prevent hematoma formation and ensure patient safety.